Healthy Choices, helping you live healthier. Sponsored by Intermountain Health.
Improving access to healthcare reduces the amount of sick days for kids in school. Joining me now in this sponsored interview is RN Amy, back with Intermountain Health, along with Nurse Aubrey for the Wasatch County School District with more. Welcome, you two.
Thanks. Thank you so much.
I think this is a must for this time of year when kids start to get sick and spread those germs around. This is all about reducing those missed school days and keeping parents from having to leave work to take children to appointments. Amy, jump in with how this telehealth is different.
Yeah, well, this program is really incredible in the sense that we've created a process where we can see kids at school with the permission of their parents to treat them for over 20 different illnesses. And this allows us to really provide the care they need while they're in school without having them to miss the class.
Aubrey, what were you seeing in the schools, and why will this be such a game changer?
You know, chronic absenteeism is a huge problem all over the nation, but here in Utah, we're no different. So last year, we saw 27% of students in Utah were chronically absent. That means they're missing more than 10% of school. A lot of these kids are missing 20 days in a semester or more. And we know that it's hard to access healthcare. We know that it's hard on students when they're not in class, they don't learn. It's hard on parents when they miss work. They might not eat that night. You know, if they're an hourly employee and they don't have time to take off, it's expensive in their home to take time off.
Yeah, and there's such a trickle effect. Like you said, then the parent maybe goes without something, or maybe you can't get into your doctor in a timely manner. So being able to be seen for over 20 illnesses, what are some of those?
So typically, the most prominent is ear infection. And so a lot of kids are seen in the emergency department. It's our #1 chief complaint. And the minimum amount of money you would pay for that is around $350 for an ER visit, which is on the low side. So through our Intermountain Connect Care providers, you can access a really cost-effective, quick service and be treated in school, and the prescriptions sent to your pharmacy, the parents can participate. It's a win-win for everybody.
Well, I can't imagine how big of a relief it is to know that you're in the hands of Intermountain Healthcare versus maybe trying to find a clinic open after hours, or sometimes there's not one open by you. I mean, every parent has been there and knows that struggle. What are parents saying? What is the feedback with that?
You know, they've loved it. We've had 100% parent satisfaction. We've had 100% administrator satisfaction. Nurses are practicing at the top of their license, which is a reward for us. So it's been great for everyone.
And how do kids need to get signed up and get involved and get that parent permission, get all signed off, so should they need it, it's right there ready to go?
Yeah, so that's what we're trying to do right now. We're spreading the word. We're encouraging school districts to get involved. We have a partnership right now with Wasatch School District, and they're the only school district that's participating. So we're looking for that interest and availability from other school districts to expand.
Wow, right now only with Wasatch. Okay, if you are listening, if you're tuning in, spread the word, because we need it. All of us here will want that in our districts. And as we wrap up, let's just give people a couple of tips, just reminders this time of year as the weather changes to stay healthy. Wash hands.
Flu vaccine is very important. Wash your hands. If your kid has a fever, we want them to be home. If they're mildly ill, they can come and learn.
Yeah, I love it. There you go. My sons need to hear that too. Okay, thank you both so much. And for more information about the Intermountain Health School-Based Telehealth Program, contact Shelly Cooper right here. We will link to her email where you can reach out and get your school all signed up. Thank you both so much again.
Thank you.
And thanks to Intermountain Health for this sponsored interview.